Temporomandibular joint, TMJ, is the articulation of the condyloid process of the mandible and the interarticular disc with the mandibular glenoid fossa of the temporal bone. TMJ consists of the following parts. First, the mandibular or glenoid fossa. Second, the condyle or head of the mandible. Third, the articular disc or meniscus, which is found between the condyle and the glenoid fossa. It divides the synovial joint or TMJ into upper or superior compartment and lower inferior compartment. Fourth, synovial cavity. This slide shows nice pictures where the condyle here, the head of the mandible, that articulate with the glenoid fossa of the temporal bone, and interposed with the meniscus, which is a fibrocartilage that is attached at the margins with the articular capsule, which is a capsule surrounds the TMJ. The meniscus divide the TMJ into upper compartment and lower compartment. The movements in the upper compartment is mainly gliding antero-posterior, in which the condyles and the cartilage move as a unit, while the movement in the lower compartment is hinge-like. Therefore, condylar path is the controller factor in the mandibular movement. The mandible articulated with the other bones of the cranium through a group of ligaments, which are the temporomandibular and capsular ligaments, sphenomandibular ligament, and stylomandibular ligaments. These ligaments work to limit the movement of the mandible. Every movement in our body is ruled by muscles, and the muscles that control the movement of the mandible can be classified into three groups: closing muscles, gliding muscles, and opening muscles. The first group of muscles is the closing muscles. These muscles originate from above the mandible, so they can elevate the mandible. These muscles are the temporalis muscle, masseter muscles, and medial pterygoid muscle. The second group of the muscles that can control the mandible movement is the gliding muscles, which are the medial and lateral pterygoid muscle. Lateral pterygoid muscle can work as a steering mechanism, so it can protrude the jaw or to move it laterally. The third group of muscles is the opening muscles, which consist of the suprahyoid muscles and their origin below the mandible, and the infrahyoid muscle. And the lateral pterygoid muscle can act to open the mandible. Mandibular axis. There are three axes around which the mandibular movements take place: in horizontal, sagittal, and frontal planes. Please pay attention to the difference between the axes and the planes. These axes include the following. First, the hinge axis of the mandible, or transverse horizontal axis, an imaginary line around which the mandible may rotate within the sagittal plane during the opening and closing movement. The second axis is the sagittal axis of the mandible, an imaginary anterior-posterior line around which the mandible can rotate when viewed in the coronal plane or the frontal plane. The third axis is the vertical axis of the mandible, which is an imaginary line around which the mandible can rotate through the horizontal plane.